Welcome to USMLE Sarthi. We are committed to empowering IMGs. We're excited to guide you on your match journey. Don't forget to click subscribe and turn on notifications so you can get notified whenever we add new content. Also, follow us on Instagram and Twitter for the latest tips and tricks regarding everything USMLE. Now, let's dive into it.
Good morning, good afternoon, good evening. Today we have our student Maharishi Patel who did a very unique telerotation, and we wanted to get his thoughts on his learning on this telerotation. So welcome, Maharishi.
Yep, thank you, sir.
So why don't we start with a bit of introduction about you? Tell us about yourself.
Yeah, I am Maharishi Patel. I did my MD medicine from Jawaharlal Nehru Medical College in Wardha, and I completed my step 1 in 2020, just before the COVID. And after that, since it was COVID, I did not do the further, and I take my PG set and I pursue it. And right now I am preparing for step 2.
Okay. So as part of your USMLE journey, you decided to do this hem-onc telerotation with Dr. Siddiqui through Sarthi. So tell us a day in the life. How did it start? How was the orientation? And then what would a typical day look like?
So telerotation usually was on Wednesday and Thursday. So it was 4 days, it was 4 weeks. So around 8 days long. So each day it's around 3 to 4 hours. And usually they have provided us a link, Zoom link. So we have to log into that and our telerotation starts. So Dr. Siddiqui was my attending physician. So she took rounds with us, and she asked patient, so how is it, and do the follow up questions, and in between we can ask her anything if we have any doubts, and we have some discussions, and yeah, it was a good learning, and simultaneously because it was only 3 years long rotation, then we can do our reading and studying stuff. So it was good experience for me.
Yeah. And so on a typical day, you would see about more than 10 patients?
Yeah, around 15 patients.
15 patients a day.
Yeah.
Okay. So you have done your residency in India. So what differences did you see when it came to patient communication, interaction with the attending?
So in comparison to India, because this USA system, empathy and communication, they are giving more weightage to that. So Dr. Siddiqui ask patient and understand him or her better, and then if some severe cases comes to the clinic, and then obviously how to handle with that, and end of the life care and everything, how to explain to the patient, and if patient asks anything to the physician, so how to attend that question and how to explain everything to the patient from 0 to 1, everything. So it was good, the communication.
And if there are other students who want to do USCE or rotations and all that, what would you say to them? How should they be prepared? Because I'm sure there are surprises, there are things that you did not anticipate. How should they be prepared for rotations? What should they be focused on?
If they are applying for this match, or if they are preparing, so they can do the telerotation, they can opt for it, which is really good for their preparation. And if someone wants hands-on rotation, which is basically you have to go there and you have to do everything. So of course because of the time thing, you will not get that much amount of time for the preparation. So I think telerotation will be better if you are preparing, and after your exam, if you do the hands-on, it will give you the idea how the USA clinical system works and how the hospital works.
Okay, so that's good. And what all have you learned from this rotation that you think will be useful to you in maybe your other rotations and in general in the USMLE journey?
Yeah, so basically it was hematology oncology rotation. So from it, there are so many patients regarding anemia or cancers, myelodysplastic syndrome. So you can get some insights and information to how to deal with the patient, what investigations you should do, and what treatment you should put the patient on. So it was a nice learning. And if a patient comes to you with a stage 4, so how to explain him or her, how to deal with it, and how to console him. So it's a good idea which gives you that learning.
Well, thank you very much, Maharishi. This was great. I'm sure will be very helpful to other students and other applicants, and including you for other rotations that you may undertake. So thank you
Yeah.
very much for your time.
Thank you so much, sir.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.